Well, good afternoon. We certainly welcome you to our Life Enrichment Hour. We are certainly grateful to have with us our distinguished professor of WSU and Larksville board member, Dr. Medvane. He is going to come and introduce our guest speaker today. We're privileged to have him. Let's receive him.
Well, this is wonderful to see so many people here. This is all right.
Speak clearly into it.
Yes, sir. I'll leave it like this, maybe. This is better? Yes, much better. Okay. It's wonderful to see all of you here. This is a terrific turnout, and we're so pleased that you're here. And I think you're going to be very interested in Breanna's talk. It's a pleasure and an honor for me to introduce Breanna Bullard, who will be presenting to us about understanding dementia, what it is, and who does it affect. As you know, if you saw the flyer, Breanna is currently a doctoral student in clinical sciences and psychology at UC Berkeley. And for the past 2 years as a doctoral student, she's been working in the psychophysiology lab, exploring the predictors of emotional burnout in caregivers of people living with dementia and ways to reduce burnout. As I introduce Breanna, I want to start by telling you the story about how Breanna came to be invited to give the talk today. It's a wonderful story. I first met Breanna when she started as an undergraduate at Wichita State in 2014. Now, I think this is right. And you were a student in an honors social psychology class that I was teaching. And Breanna was a very bright student and a terrific human being. And after the talk, I invited her to be part of my research group, which included both undergraduates and graduate students, and our focus was on aging. And she helped several of the doctoral students, and one in particular, with a master's thesis, and that involved interviewing residents who were just entering a life plan community like Larksfield Place about their hopes and dreams and fears and goals about the future. And it was during the time that Breanna was an undergraduate at WSU that she developed an interest in working with people living with Alzheimer's disease. She had had prior experience working with people, adults, with intellectual disabilities because she worked at Starkey for 2 years. In August 2015, she answered an ad posted by a family, and the ad was requesting a psychology student who might be interested in working one-on-one with their mother, who was living with Alzheimer's, and she was a resident of Larksfield. The family wanted someone to help their mother keep her company and talk with her. And Breanna worked with their mom for a year until she passed away in July of 2016. And that same week, Breanna started a certified nurse aide training program and completed the program, and for the next 2 years, worked at Larksfield Place with residents who were living with dementia and their family members. Breanna graduated from Wichita State in May of 2018, and she completed an honors thesis, and that turned out to be a follow-up of the original study of people who were interviewed as they were entering a life plan community. Breanna's dream has always been to be a clinical psychologist. She was always interested in working with people who were living with cognitive impairments. So the next step for Breanna was completing a master's degree in psychology and brain sciences at Boston University, which she completed that in 2020. Then she applied to the top most competitive programs in the country in clinical psychology, and guess what? She won first prize. Berkeley is one of the 5 best programs in the country, and the most wonderful part of the story is that she was admitted in part not only because she's very bright and motivated, but also because of her experiences at Larksfield Place as a CNA working with residents living with dementia and their families. As it turns out, her advisor, her PhD advisor at Berkeley, had been doing years of research on dynamics with marital couples and interested in what predicted satisfaction and dissatisfaction. And he decided and got an NSF grant to switch his area of interest to study caregivers, where one of the spouses was a caregiver and the other was living with dementia. And this was a new research program for him. And so when he saw Breanna's application, he knew he had the perfect person for his group. So Breanna's dedication to working with people who can't communicate what they need, her ability to understand them and succeed in making them feel comfortable and making them feel cared for, and her love for advocating for this population and working directly with them led her to be selected into this doctoral program at Berkeley. So it's a wonderful experience, and there's an element of payback here. Because of her experiences working here, she got into this prize program. So it's kind of a terrific thing. Breanna and I have kept up and kept in touch over the past 4 years, and I've listened with fascination as she told me about her research at Boston University and then at Berkeley. And then as I listened to her, I thought, gee, wouldn't it be wonderful to bring her back to tell the Larksfield community about what she's learned and the research that's being done at Berkeley with people living with dementia and their caregivers. And the work that she's been doing, which is to figure out predictors of burnout and how to reduce burnout. So she comes at this not only with the most recent scientific training in brain science and cognitive impairment in dementia, which she'll be telling you about, but also more than 2 years of experience with people living with dementia and their caregivers. So in summary, Breanna graduated from WSU with a BA in psychology summa cum laude in 2018. She graduated from BU with a master's in psychology and brain sciences in 2020, and she's now starting her 3rd year at Berkeley in their doctoral program in clinical science. And she's told me that she won't be taking any more classes. No. That's the best part. So she's going to be telling us about understanding dementia, what it is, and who does it affect.
Thank you all so much. It's so wonderful to be back here at Larksfield and to be able to tell you all a little bit about what I've learned over the past few years and the research that's being done to help this population of people living with dementia.
Please adjust the microphone.
Is this better? Yes, okay.
Speak right into it.
Will do.
Any more instructions, Bill?
All right, I feel confident you'll let me know if I need adjusting. All right, so thank you, Dr. Medvine, for that wonderful introduction as well. So today I want to talk a little bit, this is the outline of what I want to talk about today. So I want to give a little summary of what Dr. Medvine told you about why I study dementia, a little bit about who gets dementia, what are the risk factors, and what are some of the protective factors. What is dementia? What does it look like in a person? And how do we support people who are living with dementia, and how do we support their family members? So as you know, I graduated from Wichita State in 2018 and worked at Larksfield as a CNA for 2 years. And those experiences really got me interested in the questions of how can we support older adults, and how can we especially support them when they're living with dementia. I graduated from Boston University, where I studied memory and learning, and I learned some more of the basic brain processes of how we remember things and how we learn things. And then now I'm at Berkeley, studying how people are affected when their spouse has dementia, and researching some possible interventions of how we can support these families. So who gets dementia? Can I just see a raise of hands in the room? How many of you know someone who's affected by dementia? Okay, so pretty much everyone, as I expected. So right now in the US, about 6.5 million people are living with dementia. the estimated risk of getting dementia by your gender. So women are about twice as likely to develop dementia throughout their lifetime than men at the age of 45, and that risk increases for both men and women at the age of 65. And we all have an idea that the risk of dementia may be increasing. We're hearing more and more about it every day. And this is largely because your generation, the baby boomer generation, is getting older. And the biggest risk for dementia is age. So it's not necessarily that the rate of dementia is increasing. The number of people that are getting dementia is increasing as our population gets older. So as you can see in this graph, this shows the predicted number of people that will have dementia by the year 2060. So the graph starts at year 2020, and it's separated into a blue, yellow, and purple field. The blue line is people aged 65 to 74, and we can see from 2020 to 2060, that number is staying about the same. And the yellow field is people aged 75 to 84, and the purple field is people aged 85 and up. So we can see that the purple field is getting much, much larger. So as people are living longer, as there are more people living longer, we'll see more people that are living with dementia. So what exactly is dementia? Well, there's a lot of things we do know about it. Dementia is a broad term for diseases that affect the brain. They cause progressive damage to the brain, meaning it gets progressively worse over time. And it causes changes in several areas of your well-being, including memory, which is the most common symptom that we know of. Your personality, so changes in how you interact with other people. Reasoning, how you think about things, how you process information. Perception, how you actually see things in your environment. I remember working with a woman here with Alzheimer's who had a tough time walking from a carpeted floor to a tiled floor because she was seeing the tiled floor as a pool of water. She wasn't having a hallucination, it was how her brain was processing the shiny floor. So it can cause these changes in perception. Communication, it's much more difficult to say what you're thinking, what you need, what you're feeling, and it's more difficult to understand what other people are telling you. And emotion. This is a symptom that I think people maybe aren't as familiar with, so some types of dementia can actually cause changes in how you experience emotion. So one task that we do in our lab is we have people sing happy birthday, and then we film them singing, and then we make them watch the video back of them singing happy birthday. Most people might cringe at that or laugh or feel a little bit embarrassed watching themselves singing. But people with some types of dementia don't feel that kind of embarrassment. And changes in physical ability. So some people experience difficulty writing or using their hands, and some people find it more difficult to walk at a steady pace. And obviously there's a lot that we don't know. So for the most part, we don't really understand what causes dementia. We know that there are some plaques that are developing in the brain, and these plaques, you can think of them like tartar on your teeth. They're buildups of a certain type of protein in the brain and then can cause the cells in the brain to die off. But we don't know exactly what causes these plaques, and we don't know how to stop them from forming. We know that any damage to the brain can cause dementia, such as a traumatic brain injury, for example. But we don't know why some people would recover from this and some people don't. And we don't really know how to prevent it yet. There's some medications on the market that I'll talk about briefly later, but we're not really sure how they work or how well they work. I also want to talk a little bit about the difference between normal or typical aging and dementia. So some examples of typical signs of aging, forgetting exact details. So if you're trying to remember your senior prom night in high school and you can't remember your date's name, that's a normal sign of aging. Forgetting which word to use, so that when you have a word on the tip of your tongue but can't quite remember it, that's a normal sign of aging. And losing items but later finding them. So if you leave your keys on the kitchen counter and can't find them, and then later you remember where you put them, that's a normal sign of aging. Dementia is an inability to make new memories. So not being able to remember someone you recently met. Trouble having a conversation. So trouble keeping track of the train of thoughts or ideas in a conversation. And the inability to find items, even if you just had it, not being able to ever remember where you placed an item. There are also many different types of dementia, and I want to talk about just a few that are the most common types. So the most common type is Alzheimer's disease, which I think people are most familiar with. And these are some of the early signs and symptoms of Alzheimer's. So changes in memory, planning, like planning out your day, learning new things, and changes in visual perception, like I talked about earlier with the woman who had difficulty walking on a tiled floor. And that pink region that I have highlighted there is the region of the brain that's usually affected first with Alzheimer's disease. This is called the temporal lobe of the brain, and that's really responsible for making and processing new memories. And this is where we usually see the first signs of the plaques in the brain. Another really common type is called frontotemporal dementia, and this affects both the frontal and temporal regions of the brain. So the first signs of this type of dementia are changes in personality and self-control. So this can look like somebody cursing more than they usually would, or being more impulsive, changes in emotion and empathy. So emotion, like not feeling embarrassment, like I mentioned earlier, and changes in empathy, so not really understanding the emotion that someone else is feeling. We do an interesting study in my lab where we have couples sit together for 10 minutes and have a conversation about a point of conflict in their relationship. So we ask them to argue with each other for 10 minutes. And we see with this type of dementia, the person has a much more difficult time understanding when their partner is mad at them. So we see this change in empathy, and that doesn't mean that they're cold or callous. They're trying to understand, but they just can't. Vascular dementia is another common type, and this is caused by damage to the veins in your brain, so the vascular system in your brain. And it's also heavily affected by strokes. So depending on the area affected by the blood vessels or the strokes, this can look like confusion, difficulty with planning, difficulty with communication, and then memory problems as well. And then the other form of dementia that's pretty common is called dementia with Lewy bodies. And Lewy bodies are a specific type of plaques that form deeper in the brain. And these can lead to visual hallucinations, so seeing things that aren't actually there, difficulties with concentration, physical abilities such as walking. They tend to have a much more difficult time walking steadily, and difficulties with reasoning. And this is the proportion of people with dementia that have each type of these four common types. So Alzheimer's is by far the most common type. It makes up about 70% of dementia cases. The next common type is Lewy body dementia, and then vascular dementia, and then frontotemporal dementia, which is about 5%. And it's more common than not to have more than one type at a given time, especially with vascular dementia. So who gets dementia? I want to talk a little bit about the risks and protective factors. So age, like I said, is the biggest risk for dementia. And then genetic factors as well. So if you have a parent or grandparent that had dementia, you are at a higher risk. Having a traumatic brain injury at some point in your life. Exposure to toxins such as air pollution or lead poisoning. Cardiovascular disease, diabetes, and then smoking and alcohol use as well. So some of these things are within your control and some, of course, are not. And then the protective factors. having a higher education, engaging yourself in mentally involved work, being socially active, being physically active, including both aerobic and strength training, and learning new skills. And I want to highlight that these are all correlational factors. So if you decide to go and get your PhD after this talk, that doesn't necessarily mean that you'll be at a lower risk, but it means that of the people that don't get dementia, they tend to have more of these protections and fewer of these risks. And then some of the treatments for dementia. I want to talk a little bit about the pharmaceuticals. I want to reiterate that I'm not a medical doctor, but these are some of the common medications that are being researched now. So in the purple section, you can see 3 common medications that are used to treat dementia. You might have heard about a recent one called Adulam that was just approved this year to treat Alzheimer's. And testing is not yet conclusive on how effective these medications really are. But they may have some mild benefits, but they cannot reverse damage that's already been done to the brain. One note about vascular dementia is that it is the only really treatable form of dementia. So if you have vascular dementia and you're treating cardiovascular disease through blood pressure medication, being physically active, doing what your doctor tells you, that can show some improvements in vascular dementia. Some other therapies and interventions that have been shown to be helpful include occupational therapy. So working with an occupational therapist to make up for some of the disability that you may be experiencing. Just like if you have a hurt knee and you use a cane, there may be some ways you can help cope with some cognitive deficits. Modifying the environment around you, so making it easier to get around your home, putting reminders up around your home if you're forgetful, and then having a structure and routine so that it's easier for you to go throughout your day-to-day life. So with that being said, I want to highlight why I'm focusing my research on caregivers. So there's been a lot of research that has shown the well-being of the caregiver, the person that's taking care of the person with dementia, their well-being directly impacts the well-being of the person with dementia, the care recipient, and vice versa. So one study actually found that when a caregiver's well-being, if they report that they have worse emotional well-being, that actually predicts a lower lifespan for the person with dementia. So I think it's really important that we help support the family and the caregivers involved as well. So there's formal and informal caregivers. So I was a formal caregiver here at Larksfield. I was trained and paid to care for people with dementia. Most caregivers are actually informal caregivers, meaning they're the spouse or children or family friends taking care of the person, helping them with their day-to-day tasks. And these informal caregivers are at increased risk for depression and anxiety because of the stress of caring for another person. So I think it's really important that we find ways to help support the person caring for this person in order to help the person with dementia. There's 3 main types of support that caregivers give. Emotional and social, so helping the person be socially active, helping them process emotional changes. Financial support, paying for medical interventions or seeing the doctor. And then functional and physical support, so helping them get around, helping them change their clothes. And I have this quote by Rosalind Carter, who is the former First Lady, and also the founder of the Rosalind Carter Institute for Caregivers. And I think it's a really profound and important quote. She said that there are only 4 kinds of people in the world: those who have been caregivers, those who are caregivers, those who will be caregivers, and those who will need caregivers. So my lab right now is looking at interventions to support these caregivers. Some interventions that have been researched include support groups. So the National Alliance on Mental Illness provides support groups for caregivers across the country, some of which are in person, some of which are over Zoom on your computer. Individual therapy. This can help process the changes in your relationship with this person and also process any symptoms of depression or anxiety that might be coming up. Formal care services like we offer here at Larksfield, home health aides that come to your home and help with functional care needs, and adult day services. My lab specifically is studying how technology might be able to help stay connected with loved ones and be an extra set of eyes for the caregiver. So I'll talk a little bit about this study that we've been doing for the past few years and are still doing now. We partnered with a company called People Power, which is a company located in Palo Alto, to develop an app that uses artificial intelligence to help caregivers. So how it works is that they help set up some sensors in a caregiver's home that collect data about movement throughout the house and use artificial intelligence to send warnings or notifications to the caregiver's phone if someone were to fall, or if a door is left open, or if the medicine cabinet is opened. So we've been testing how caregivers like this technology, if it's helpful, and how it may be helping both the caregiver and the person with dementia live a better life. So this is a graph that presents some early results for this study. So I'm going to walk through it because it's a lot of information up there. So I looked at how caregivers felt anxious before and after COVID lockdown. So this was a national study, so this was looking at across the nation how anxious were caregivers feeling 9, 6, and 3 months before COVID, and then 3, 6, and 9 months after COVID. So the pink bars are people who did not receive our intervention, did not receive the technology, and the blue bars are people who did. So you can see the blue bars are much lower than the pink bars after COVID lockdown. So we believe that our intervention helped people feel less anxious while they were home with the person with dementia longer. And we found a similar result with burden, where their sense of burden was reduced in the blue bars than the pink bars. And on our future studies, we're hoping to look at caregivers who are living in more rural communities who might not have as much access to resources, and also Spanish-speaking families who might have less access to resources that they can actually understand. I did put a link to our study if any of you are interested in getting involved. I can give you more information about if you might be eligible to participate, if that's something you might be interested in. And some future questions about how technology could help caregivers. So you might be familiar with Apple Watches or those fitness watches that people are wearing. There's some research being done to see if those could help prevent falls. It might be able to give you more medication reminders so you don't forget. And these might be able to help overall improve the well-being of both the person living with dementia and the people that love and care for them. So with that, I'd love to take any questions that you guys have for me and about my research, and thank you again so much for having me.
How many people have you tested that are using this app? 100, 1,000?
Chuck asked how many people have we tested. I think as of right now, we've tested just around 300 caregivers. Do you have a question?
Yeah.
Yeah.
We've talked a little bit about the dynamics of the caregiver couples and what leads to better outcomes. And can you talk maybe a little bit about that and how caregivers might be helped to improve outcomes?
Yeah, so Lou asked how the dynamic of the caregiver and the person with dementia, how that dynamic might affect the caregiver. There was a study that someone else in my lab did that found caregivers that were more emotionally empathetic actually had a harder time when their spouse developed dementia. And as you can imagine, if you're more affected by another person's emotional well-being, that would have a big impact on you. So that was one thing that we found, that being more emotionally involved in the relationship had a negative impact.
Do you have any handouts on what you have just presented here? Do you have any handouts on what you've presented here?
I'll make my slides available for you all.
Your slides.
Mhm.
Again, you gave us a website for those. Are you going to do that to me? Okay. You gave us a contact website which talked about your research. Does that go into more data and information about kind of a general thing, so it might be helping the question that she asked if there was other handouts and things?
Yeah, the website has all the information you'd need about the study if you're interested in participating, as well as some more information about the results that we found. So I'll make sure that's available on the handout as well.
Do we have access here at Larksfield for a person, a caregiver, to have counseling or to ask questions about how they're doing, or is there something set up here?
Not to my knowledge. I don't know if Larksfield offers any counseling services like that, but I do know there's external resources to receive counseling from here at Larksfield.
Do you have information about other towns? My sister lives in Topeka, and my brother-in-law had Alzheimer's, and she called all over, asked everywhere, could not find anyone to come out to the house to help. And one company, finally, she needed someone to stay at night because he was up and down all night. Do you have anyone how you can contact, or are there people out there that you can?
That's so tough. I know, especially the past few years, these resources haven't been as available because so many people need them, and there just aren't as many workers. The workforce just isn't there to help everyone. So I'm really sorry your family has experienced that, and I don't know of any other services in Topeka specifically, no.
I would suggest that a good place to start is the church. There are a couple churches here in Wichita who have been very, very good about visitation groups. And then there's the RSVP program, where volunteers volunteer to go and sit with a demented individual so that the caregiver can have a little respite. But the churches are always a very good place to start.
Yeah, absolutely.
So I'm actually a caregiver. I'm here because I actually got to help Glenn's wife, Betty. I worked for Home Instead Senior Care here in town, and they were an exceptional agency to work for and to work with, and they were a wealth of information. Everything I learned, I actually learned through them. They had paid training that they actually gave, and their instructor was phenomenal. But I've also been in contact with the Alzheimer's Association here in town, and they are an incredible wealth of support. You can call at any time with any questions, and they're also very knowledgeable and could probably direct you to the local agencies here that would get you some support and some help. They also know about the caregiver support groups that are available here in the area.
how aware are family members of the developing dementia in their family members? Are they slow to learn, or denying it, or what?
That's a great question. I think that's a difference that you see between families. I think some people may be in denial. I mean, you can imagine losing your spouse to dementia could be really difficult to accept. I think other family members recognize it early on, and I think that's why it's so important to know these early symptoms so you can recognize it when it's happening early on and get to resources quicker.
Thanks. Can you speak some to diagnosing dementia and specifically Alzheimer's?
So a diagnosis usually involves seeing having a neuropsychiatric evaluation, which can be a pretty extensive process to actually get a full diagnosis. It usually takes at least a few hours. They can be pretty costly, so it's not something that everyone can get access to, definitely. There may be, I know in Berkeley, for example, people can get diagnosis for free as part of our study. So if there are research studies in the area, which I don't know of any right now, that may be a great way to get a diagnosis.
A year or so ago, there was publicity about a new medication that had come out, but that it was thousands of dollars expensive. And they were not sure if Medicare would cover it. Do you know the name of that medication, and is it available? And do you know if Medicare did cover it?
I don't know if Medicare decided to cover it. I do know it was tens of thousands of dollars is what they were wanting to charge. And I will say in addition to that, there hasn't really been any research that's shown it's effective at making your symptoms better or improving quality of life.
What was the name of it?
Oh, Abdulum. Abdulum.
One other resource that people might look into is the AAAs. I think it's Central Plains AAA here in Wichita, but they're throughout the state, and they're funded nationally, and they are a good source of information also. I think Alzheimer's is a great source, but AAA sometimes have volunteers or have people that can help sit, I think, also. Yeah. Yeah, it's the Agency on Aging. It's not the one that you fix your car with.
My best friend's husband died of Parkinson's, and he had Lewy body dementia, which is the kind of dementia that often goes along with Parkinson's. He died in a nursing home that had apartments around the periphery of the nursing home. Claudine would go down and spend, when we knew he was very definitely terminal, but even before that, when she would go down and stay almost 24/7, and she'd go home to shower, she'd come back home and there would be always 2 people from the apartments who came to sit with her husband while she was gone. And while she was gone, the nursing staff had come in and freshened up his bed. It was just amazing. I don't know how they started this at that nursing home. It was Prairie Homestead, and I believe that that's a Baptist facility. But boy, that worked just very, very well.
Mm-hmm.
How early in age do you see some of these things happening? And in addition to that, is it common within a family?
So as far as how early you can see these symptoms, it varies from person to person, as early as your 40s, most commonly in your 60s to 70s. And as far as within a family, there are certain types of dementia that are more common to be genetic. So Alzheimer's is more genetic than other types. And they've identified certain genes that are more common.
I can't remember the other question I had for you.
Hopefully it'll come back to you.
Have they found any connection at all between seizure activity and Alzheimer's?
That's a good question. Not that I know of, but I can't say for certain.
Seizure.
She asked if there's a connection between seizures and Alzheimer's.
Is there in fact a connection with aluminum?
I think aluminum poisoning, if you have an overexposure to any type of metal poisoning, yes. As far as aluminum in your deodorant or like the alloy fillings that are in teeth, I don't think there's any connection.
Yeah, you had commented about if we're experiencing some things that seem to be early symptoms of Alzheimer's, which many of us are. Some of the things that can help in terms of structuring the day, and maybe talk a little bit more about that?
Sure, yeah. So your question is about what can help with just typical aging? Sure, yeah. So some of the things that can help with the protective factors that I talked about with, let me go back in my slides. So things like keeping your mind engaged with learning new things, learning new skills or hobbies, trying new physical activities. If you've never done swimming before, that's a great physical activity to keep your body moving. Being socially active as well. So social activity, physical activity, and mental activity are all things that can really give you the best chance at keeping your mind as healthy as possible.
I have a situation in which my father has dementia, and he likes to be on his computer, which is great, but he's getting to the point where he'll just point on anything, even pornography. And my family and I want to close his email account so he won't be doing that. But is there anything else we could do? Because we want him to be able to listen to his music. That's so important to him, but we have a dilemma of him pushing on wrong sites.
That's a good question. I mean, I know there's things you could probably do on the computer that limit what sites you can go to. There might be video games online that he'd be more interested in that would keep him engaged, that would actually be helpful to be on. But that's a good question.
Family members and friends don't really see the change because they're so slowly progressive. And at a period of time, they don't recognize that they are in fact demented. How do we counteract that?
Yeah, so how do you recognize these changes when they're so gradual? That's tough. I think they're usually, for the people I know that have had dementia, there usually becomes a point when they can't do something, a specific thing that they used to be able to do. Whether that's playing golf or being able to remember the route home when they're driving. And that usually is kind of a wake-up call for the family or for the person to realize that something's wrong.
Are there things a caregiver shouldn't do in dealing with dementia?
That's a great question. Yeah, there's this idea of rolling with resistance that I was taught as a CNA, and I'm being taught now as a clinical psychologist, where if a person is giving you resistance, if they don't want to do something or they're not understanding something, you can feel this urge to keep pushing and keep trying to get them to do the thing that they might need to do, whether it's putting on their shoes or taking a shower or eating their dinner. And the worst possible thing you can do is to keep pushing them to do something they don't want to do. I mean, people that don't have cognitive deficits feel that same thing. If someone was telling you, you need to take a shower right now and you didn't want to, that's not going to make you want to do it anymore. So rolling with their resistance, trying to understand the deficits that they have and understanding that they're doing the best they can, and trying to work with them with the abilities that they do have.
So as a parent, you have the ability to put parental controls on your computer. Is that something that you think might help her situation? Because then you get to control where he would get to go on his computer. So that might be something to check into.
Definitely, yeah. I'm noticing you all have a lot of great resources that are kind of answering each other's questions. You know, with resources at the church, the AAA service. I think you all have a wealth of resources at your disposal just with each other, it sounds like.
The other thing, like with my dad, you were just talking about the getting him to do it. Like we have a struggle getting him to shower, and there's just, you were saying about, but if we don't do it, he won't do anything for a week or so. It's like what my sister's trying to see if one of the nurses at the AL would do it. That's probably best way to do it. Because my sister's getting really bogged down, is trying to figure out how to get him to do it. And she has no choice but to push it because, I mean, there's nothing else she could do.
Mm-hmm. Yeah, I remember when I was working here, you had to find little tricks for each person that to kind of trick them into realizing this is something that they want to do. So I remember one resident, I remember telling him he kept wanting to go on a flight to New York. And so I told him, like, well, you got to get cleaned up for your flight, and then your flight leaves first thing in the morning. So the shower room's open right now, so why don't you get that taken care of so you're ready to go in the morning? So there's, you have to really know the person and learn how to kind of trick them into realizing this is something they want to do. Yeah.
I just want to remind us all, do not overlook the power of prayer.
I was just going to say something about showers. This is something that actually people have studied quite a lot, and there's a well-known intervention called bathing without a battle, about nursing homes and nurses and nursing assistants. And the gist of it has to do with people being upset by being put in a shower and the water and the temperature of the water. And so one innovation around that is dry showers, where it's possible there is soap that you can use and it doesn't require putting a person in a shower, and it is hygienic. And so, I'm sorry? What's a dry shower? Dry. Yeah, it's, I'll send it to Jermaine. It was something that got a lot of publicity some time ago called Bathing Without a Battle, and it's an intervention that was implemented in a number of nursing homes. And actually, I remember the video vividly. They showed physically struggles with the residents and the nurse aides, and people hitting and cursing. And really the thing that was setting people off, it's like know the person, the thing that was setting people off was the temperature of the water and the getting naked and the indignity of that, and the impersonality of it. And how this technique is about cleaning people while they're in their beds, and that there are products that can help you to do that. Yeah.
Yeah, they do have those here at Larksfield. They have the shampoo that doesn't need to be rinsed out of the hair, and soap that doesn't need to be rinsed off your body as well.
Jermaine, you try the dry shower and let us know.
For those who grew up out in the country without running water in the house, we learned to do a spit bath. And when you have demented people, sometimes you have to be satisfied with just quickly washing the smelly parts. And you do the smelly parts, and I was talking to a bunch of nursing home administrators one day, and one of them said, "Do you know what a PTA bath is?" And I said, "No." And he said, "Well, it's peri, titties, and armpits." But you see, back in days before, we did spit baths. And oftentimes you have to resort to that with somebody who has dementia.
Sure. Any more questions, or otherwise let's thank Breanna for you talked a little bit before this, so if you'd like to engage her in some discussion or conversation, she's very open to talking with you. So,
Thank you all again so much.
Two neurologists, a husband and wife, named Loma Linda.